gentlemen, please welcome Dr. Stephen Klasko, President and CEO, Thomas Jefferson University. Dr. Stephen Altschuler, CEO, Children's Hospital of Philadelphia, and Dr. Ezekiel Emanuel, Head of the Department of Medical Ethics and Health Policy, the University of Pennsylvania.
Thank you very much for being here. And as you heard, we have two of the giants of Philadelphia medicine, and not just Philadelphia medicine, but leaders in the nation in terms of rethinking how we're going to enter the next phase of American healthcare, which is undergoing a lot of change. As you all know, the Affordable Care Act has ushered in a lot of change. Partially, people are focused on how many people are getting insurance, but there's the bigger change also of redoing how we care for patients to make it better value, higher quality and lower cost. So I thought we would start with that issue. What are you two gentlemen doing at your various centers in terms of elevating the quality of care that we can deliver to people and keeping costs under control? So maybe we'll start with you. It's Steve.
Thank you, Zeke. Real pleasure to be here. Good morning. So if you look at CHOP, we've really been through a 20-year cycle of redefining how we care for patients. CHOP is the oldest children's hospital in the country, but literally over the last 20 years, we've taken an approach to create a network of care models. If you look at CHOP today, there's obviously the main hospital in West Philadelphia, but most of the care that we deliver is actually in our network. We have 56 different sites of care located throughout the area. By numbers, most of the care that we provide is an outpatient basis. We're able to treat patients in the most appropriate place based on the acuity of their condition, the cost, and to have the right provider there. So it's truly an integrated approach to care. And I think it's the care model that we've developed really provides the foundation for a population health approach that we believe will come as a result of the Affordable Care Act and other changes in healthcare.
Steve?
Well, thanks, Zeke. You know, when I got asked to be the president and CEO of Jefferson, I got a chance to give a talk at a Forbes Summit. And the guy before me said, the two things you don't want to be running for the next 3 years are academics and healthcare. I was the next speaker. I said, I just took a job in academic healthcare. Said they're going to be impossible. So the simple fact is this. We decided the first thing I think is saying, look, what's worked for the last 190 years in a place like Jefferson isn't going to work anymore. So instead of complaining that we're increasing access and increasing quality and decreasing cost, say, what do we have to fundamentally transform to do it? Our new vision is not we're going to be the premier academic medical center in Philadelphia. Our new vision is we will reimagine healthcare, education, discovery to create unparalleled value. So our three biggest investments, the first is in the Delaware Valley Accountable Care Organization with Mainline Health and Doylestown and Holy Redeemer with the express intent of keeping people out of the hospital. Our second biggest investment is in telehealth, looking at what can you do as a consumer? Everything we're hearing today that you can't do in health. Why the day after Thanksgiving can you be in your pajamas watching Game of Thrones and do all your holiday shopping? But if you have a stomach ache, you can't get an appointment with a physician or access health care. And the third biggest investment we're doing, you just heard from Christina Laurie, we're partnering with some of the companies that are actually working on mathematical modeling to reduce uncertainty in baseball and football and seeing if we can use some of those modules to help us reduce uncertainty in healthcare. All of those things will help us be a better Affordable Care Act partners. That's not what the traditional Jefferson had done in the past.
So I want to pick up on something both of you mentioned. You mentioned your Delaware Valley ACO, and part of the motivation is to reduce the use of the hospital. You mentioned that you're doing more stuff and you have much more activity on the outpatient side. Are we going to see this big exit from the hospital, both in terms of caring for people at home who can be cared for at home, making it easier for people to get care on the outpatient at more convenient locations? Is that part of the game plan here?
Yeah, so I think in our case, if you look today at our main hospital, which is about 535 beds, so very large as a children's hospital, over 80% of those beds are ICU beds. So our concept is as we move more care out into the network, we expand the network, we can actually use these very high cost facilities for the most complex patients. So another part of our strategy is to really bring complex patients from all over the world to the CHOP campus. And so if you look at our distribution of patients now, close to 5% of all our patients are coming from outside the United States. And they're really for the most complex services, cancer immunotherapy, fetal medicine, things of that sort. So we believe that we will actually increase the number of inpatient beds. We will just use them in a more appropriate way as we build capacity in the outpatients, and the network ultimately will grow, and we will bring more patients to Philly from outside the area. So that's the general strategy.
And I think it's similar, although it might be a little bit different in a general adult population. So at the end of the day, somebody asked me, how will you know if Jefferson's successful 5 years from now? I said, somebody came down from Mars and to Philadelphia and said, where's Jefferson? They'll say, what do you mean, where's Jefferson? Jefferson on my TV, or Jefferson over in Roden Square with Whole Foods and CVS, or Jefferson at Abington, or Jefferson up in Allentown? Oh, you mean the hospital where the really, really, really sick people go? That's still a 10th of Walnut. So I agree that with Steve, that I don't think anybody will come downtown for a laparoscopic cholecystectomy or a hip replacement, because we're always going to be the high-cost academic entity. That's partly why we've announced the merger with Abington. We want to get patients to university-level care as close to home as they can, and have the university hospital downtown be where the sickest patients go.
Well, you mentioned talking to a doctor or something in your pajamas.
Not me in my pajamas, but patients.
We can't know what the doctor's doing either. How realistic do you think that kind of care is, so that it's either telemedicine or it's walking over to your CVS to get a blood test, or are we on the verge of that actually happening?
Yeah, I think that we are on the verge, and I think that in all likelihood, the majority of care that the average patient can get, they can do on their iPhone. I think that this will be the vehicle for a lot of healthcare delivery in the future. A lot of what's done at the primary care level now will be very easy to do through telehealth, new technologies, better care models. I think it does involve more standardization of care, really understanding what the protocols are, and then ways to collect the data to evaluate that we're doing things in the right way. But this will become the major vehicle for healthcare for the majority of the population.
No, I think it exists now. When I graduated from Wharton, I had gotten a grant to look at what makes doctors different than, depending on the audience, either other people or normal people, and how we handle change. And the simple fact is, it's not the technology is not the reason that you don't do that. It's because it's hard to get 19 gastroenterologists to agree on a scheduling parameter. So the problem is with us. I think the new generation, the people that are sitting around here, are going to demand it because they can do it in every other area of their life. I got to spend a little bit of time in Cupertino at Apple and watch the period of time when Apple went from being a computer company to a digital company. We're going to have to go from being a hospital company or a university company to being a health company. And I think technology is going to be a very big piece of that. We started last week virtual rounds. Think about this. If you have a mother or father, if you have a mother or father in the hospital today in 2014, and you go, Mom, what did the doctor say? I don't know. It was 5:30 in the morning. I was half asleep. Put me over to the nurse's station. Can I talk to the doctor? He or she is in the OR all day. So what we started on November 3rd was patients will tell us who they'd like to communicate with in rounds. It could be their son in Denver, their daughter in Jordan. And we will send them software so that they can actually two-way participate in the rounds. When the doctor comes in, they'll get a text, the doctor is in. We're sending you home, Mrs. Emanuel. Hi, I'm Zeke's daughter. Do I need to know anything? Yes, you need a bed on the first floor. I'm glad you told me that. We're also doing virtual discharges, so family docs will have an opportunity to see what we told patients. That technology exists. It's just that we have to get into that age.
And how long do you think that kind of transformation is going to happen?
I think it's happening now, and I think every day there is something new. So along those lines, we have a relationship with the Virtua Hospital in South Jersey. We can do rounds with a robot in the ICU. So the robot can go in, can do an EKG, can do everything you need, and you can get the data there. we can do a remote consultation with a patient in Abu Dhabi now because that technology works out. We can read every pediatric radiology film from around the world from one station in CHOP. So it's happening every day. The business models aren't always there yet, but I think as Steve indicated, you have to take that leap of faith, you have to be the leader, and eventually the business components will follow.
So this raises three questions in my mind. First, is the physical exam dead? The hands-on touch, if we're going to do so much by robotics or by our iPhones, does that really mean the sort of human-to-human contact that the physical exam represents is going away?
No, I actually think the human-to-human contact becomes even more important. It might be different. We still accept medical students, Zeke, based on science GPA, MedCats, or organic chemistry grades, and somehow we're amazed that doctors are more empathetic, communicative, and creative. As my kids say, duh.
You mean
right?
organic chemistry doesn't make you empathetic?
Right. No, but think about this. I wrote an article called From Marcus Welby to House. How did we get there, right? So for those of you who are as old as I am, Marcus Welby was a family physician. Would get up in the morning, go to the homeless shelter, take care of people for free, deliver a calf on the road because the cow was having trouble on the way home to lunch, go to his family medicine office in the afternoon, and then do left ventricular neurosurgery at night. People viewed us as gods, empathetic gods that could do everything. Now, if you came down from Mars and you looked at House, you'd think we were narcissistic, drug addicted, very smart, analytic folks. So the key is going to be really starting to look at different parameters of what creates a great physician. We're doing a lot with art. Think about this for a second. Being able to see versus observe. We put applicants for medical school in front of an art picture of a woman with a white dress, a guy in a blue suit, and a snake. What do you see? I see a woman in a white dress, a guy in a blue suit, and a snake. No, what do you see? I see a woman in a white dress, a guy in a blue suit, and a snake. Other people can right away say, I think that snake represents the relationship between man and the woman. Why is that important? I'm an obstetrician. I've delivered 2,500 babies. Can deliver an 8-pound normal baby pretty easily. You deliver an unscheduled Down syndrome baby, and somebody says, what does that mean? It's just like that picture. They don't want to know about the chromosomal abnormality. They don't want to know about the pulmonary fibrosis. They want to know what does it mean. So creating physicians and a workforce that can work as teams and actually be able to observe and communicate and touch in a different way will become important.
Second question. With all this move to telemedicine, move to the outpatient setting, are we going to be closing hospitals? Now, I've been personally criticized since I predicted we'd close about 20% of the hospitals in the United States that either I'm crazy, those are the consultants, or I'm trying to hollow out communities. So are we going to close hospitals nationally? And then the question is, in Philadelphia, are we going to be closing any hospitals?
Yes and yes. So, the example in Philadelphia, this is on the adult world, between Broaden Market and Broaden Olney are 2,000 adult beds. 2,000 adult beds in a 7-mile area. I don't have to say any more, I guess.
At least to me, but I mean.
No, so there's going to be changes. The question is, can you create the scale, the new services where you can repurpose these institutions, repurpose the employees to do different things in healthcare? The traditional inpatient general medicine surgical stuff is going away, and it's going away very quickly. And I think you look at CHOP, that notion of repurposing the high-end, very expensive hospital for all ICU care or for care you can't get anyplace else in the country or the world. That's what it becomes. Everything else has to be done differently, as Steve said, at home or in a facility that's of much lower cost and much easier access to the patient. So yes, there will be tremendous changes. There will be many, many hospitals that will close nationally and in this city.
And it's a math equation. I mean, the way academic medical centers run, the old math has been NIH funding. Well, that's not going up anytime soon. Clinical reimbursement for inpatient procedures, as Steve said, that's not going up. Oh, we can always put it on the backs of students and increase tuition. That gig's up also. So I think the new math is innovation. The new math is investments in philanthropy. And if you look at Jefferson, that's where we're investing our dollars, not in increasing beds. It might very well be that Jefferson is a much bigger organization with a much smaller hospital in Center City, Philadelphia. We cannot have, I don't believe, 5 autonomous academic medical center hospitals in the city of Philadelphia.
Okay, so that leads me to the third question that's raised. as we're going through this, and what it sounds like is going to be pretty dramatic changes by your predictions, and certainly it sounds like both of you are investing heavily in anticipating and adopting and probably leading, I would say, these changes. What can we do in Philadelphia to ensure that our great medical establishments actually remain at the cutting edge and keep the city vibrant? Because after all, the medical establishment has been a pillar of this city, and I think one of its shining lights. Certainly attracted me to come to the city, whatever it was, 3 years ago, because I think still has tremendous potential and tremendous leadership in the country and, as you point out, in the world.
So Zeke, I'll start. My new book is called I Messed Up Healthcare in America, parentheses, put your name here in the parentheses. And the reason I bring that up is we've managed to blame everybody else for what's going wrong. So let's talk about Philadelphia. Exactly what we're proud of is our biggest liability. We have amazing universities. We're sitting in one. We have amazing hospitals. We have amazing academic medical centers. I talked to a farm industry leader who said, the thing that you brag about is your biggest liability, because what you do is beat each other up. So CHOP is not my competitor. CHOP is not my enemy. Penn is not my enemy. It's what can we do in Philadelphia? I guess the Wharton word is coopetition. How can we collaborate and compete to make Philadelphia an entity? So a couple ideas. One would be to create a Philadelphia-wide clinical research super site. So if Johnson & Johnson comes up with an Alzheimer's vaccine, there would be a single portal where they could access Penn patients, Temple patients, Drexel patients, et cetera. The second thing is, think about this. The first 2 years of medical school are basically a guy up there with a PowerPoint with this thing half full, because the kids can watch the same lecture on their MOOC at Stanford at 2 o'clock in the morning. But we have 5 different schools hiring anatomists, physiologists, biochemists to give that PowerPoint. We could probably knock down tuition by about $5,000 if the first 2 years of medical school was a citywide thing. So I think we have to look in the mirror and say, what can we do differently and make Philadelphia different?
So I'll take a slightly different approach. Again, thinking about the assets that we have here, and I'll concentrate more on the pediatric space. There are things that we do here that we've invested in that you really can't do anyplace else in the world. Gene therapy to cure blindness, and I'll talk a little bit about that, or in utero surgery, in utero bone marrow transplant. So what we're trying to do is to say that for pediatric healthcare, CHOP in Philadelphia will be the hub for the most innovative care. We will always be on the frontiers of medicine and make that investment. And if you look today, we have a direct flight from Doha in Qatar that comes to Philadelphia. 3 patients a day on every plane are coming to CHOP right now. It's pretty amazing. We're talking with Emirates Airlines to also start a direct flight. So I think it's to use it that way. The other part is to say, and Steve, I think, articulated this very nicely, is that today's academic enterprise is inappropriate, it's expensive, it's not delivering value. The metrics that we use to evaluate are no longer appropriate. So what we've said is we're going to change that paradigm. For us, it's going to be important. How do we bring new care models? How do we bring new products to market? So first time an academic institution has ever done this in the country. CHOP has put up $50 million to start a new company to commercialize gene therapy. We have a number of technologies, gene therapy to cure blindness, hemophilia, things like that. Instead of licensing the technology, we've created a company that's based now in Philadelphia up at 3737 Market Street. CHOP has put in the foundational funding. We've been able to bring in outside investors, and we're going to use this as a model to develop new commercial enterprise that's tightly linked with the institution, because we believe this is the future, and this creates something very special in the Philadelphia region.
So one of the things that this change, we're talking about change in how we deliver care. I want to push you back. Both of you are leaders of places that train lots of America's future doctors who are going to be leaders. And do we need to train our doctors differently for this new era? And how is that going to happen? I mean, you mentioned one thing, Steve. Maybe we should rethink the whole first year or two of medical school and begin to bring everyone in the medical schools together? Are there other training changes? So, how are we going to integrate medicine with nursing? Do we shorten, lengthen? Do we give more business education? Since, you've got a Wharton degree, you're one of the more astute businessmen I've ever met. What are the changes we're going to have to see on the education front?
So I would say we have to stop tinker, and we have to fundamentally start from the primordial roots. So if you think about this, when I went to Wharton, look at medical school. It's 11,000 people apply to Jefferson for 290 slots. It's look to the left of you, look to the right of you, one of you will get in. Then you get in. Now I can relax and be a team member. Oh no, look to the left of you, look to the right of you, one of you will get the best residency. And then you get into residency, et cetera. And then we're amazed we don't think it's high-powered teams. When I went to Wharton, the very first day they said the most important decision you will make is your study group, because every grade you get will be a study group grade. They put the 100 of us in a room and said, make study groups. Get somebody from finance, somebody from accounting, somebody from management. It wasn't great for me because people said, what are you? I said, I'm a gynecologist. And I was left in the center of the room. It was like gym class in the 60s. But once I got over that, you learn to be interdependent. So I think the whole key is to move toward a team-based enabled healthcare system. I think the whole thing around primary care is getting over ourselves as an AMA and an ANA and saying, what is the role of doctors in nursing practice? What is the role of PAs? We just started a PA school. We have a large doctor of nursing practice school. We can't think as a guild mentality in the past and be able to do what we need to do for the Affordable Care Act.
So I'll take a slightly different approach. I think there's tremendous things that we can do. So at CHOP, we've just started what we call the Physician Entrepreneurial Tract. And this is in recognition that the traditional way to support research is dying. The NIH is dying. So we need to train scientists who can be entrepreneurs, who can find other ways to fund. And then if you look at the care model, and I think this goes to the teamwork, but can you create new models of care that really foster changes in the way that physicians, nurses think? So one thing that we've just done is we're opening a new campus on Broad and Morris. It's a square block. CHOP is going to build a new primary care clinic. We're going to build a clinic for the city of Philadelphia. We're going to build a branch of the Free Library and a rec center, all in one campus to really foster a different way to work with the community and to educate kids. I think the other thing that we're thinking about right now is, one of the problems we have in this city, it's not directly part of this talk, is our education system is failing. As we think about caring for children in the future, I think we as an institution that's worried or is responsible for the general well-being is also now going to have to take responsibility for education as well, because that becomes part and parcel of how you're going to get the best outcomes. So I think those are ways that by forcing these new models of engagement, you can actually force healthcare providers to think in a very, very different way.
Steve, I think you bring up a great point. We're actually looking at working with the Philadelphia school system to identify students like literally at the 8th grade level with high science aptitude, to get them involved in Jefferson from that point on, almost adopting them in a healthcare big brother or big sister type way that we think will create a more diverse population. So I agree with Steve. I think as academic, medical center, and university leaders, we need to take a much broader approach, and I think CHOP is doing that and Jefferson's doing that.
So one of the things you mentioned is the sort of nationalization and internationalization of healthcare. I just flew in this morning from Atlanta, and walking through the airport, there was an ad, I think it was from Dallas Methodist or something, a big ad in the airport, and I was like, did I land in the wrong city? Why are they advertising here? And then just across the river, MD Anderson is affiliating. Are we going to see an assault, you might say, on our medical delivery system here from outside, Lord knows, Texas, to come and try to do something different and deliver care here? And is that going to be part of the future, that it's not just going to be Philadelphia medicine, but we're really talking about a national and maybe even international stage?
Yeah, I think, as Dallas is moving to Philadelphia, we're trying to move to San Antonio.
We don't want to lose you, man. CHOP has P in it for a reason.
That's probably not going to be in his next poster, I would guess.
That's, there's a Cleveland Clinic, right? You can be the Children's Hospital of Philadelphia and still be national and international. Yes, I think that the traditional borders, the traditional regions of healthcare are changing. Certainly for very specialized and high-end care, you're going to be able to get onto the internet and figure out what the cost is, what the results are, and you'll be able to go there. So I think that all of us have to now think more broadly. I mean, CHOP's vision for 2025 is that there will be a CHOP-branded facility everywhere in the world within a 6-hour flight of every child.
Wow.
The world is getting incredibly small, whether it's another country like Texas or Jordan. I spent my last week in Jordan. One of our real skill sets is looking at simulation to assess technical and teamwork competence. Think about this for a second. I'm a pilot. Every 2 years I have to get my technical competence assessed. The last time anybody assessed my surgical skills was 30 years ago. So Zeke, you're a hell of a lot safer flying with me than being operated on by me, especially since I'm a gynecologist. But at the end of the day, so we have some real skills in that. Jordan said, who should we partner with to build an assessment of technical and teamwork competence center in Amman? Turns out to be Jordan. Turns out to be Jefferson. There's no reason that you can't bring that together. Global accreditation. If you're a banker from Qatar and you come here to Philadelphia, you can be a CEO of anything. But if you're a doctor, if you're the chair of cardiothoracic surgery,
You can't go to New Jersey.
you'd have to restart your residency again. So I think that what you're going to start to see is medical tourism, as CHOP has done better than any place in the country, from Philadelphia going out, and that's good for Philadelphia. But you're also going to see where there's weaknesses in Philadelphia. You're going to see medical tourism coming in.
So in the last little bit, I want to ask you, we're going to have a new mayor very soon. Your advice to the new mayor regarding how to foster and ensure that Philadelphia medicine remains #1 in the country, near the world, as we've just heard.
Leave us alone.
Is that right? There's nothing he or she will be able to do to catalyze.
Don't make it hard to get a permit. I think that we're eager to work with the city. As you can see, I think that's been part of parcel of what we do. But quite honestly, it's not always the easiest thing to do, and you spend a lot of time that could be spent on more important things. I think that there is incredible energy in the healthcare community here, and hopefully you've seen some of it here today. And we want to do what's right. We want to do what's great for the city of Philadelphia. We've all spent our lives here. Certainly, this is the height of our professional careers. But sometimes people get in the way in inappropriate ways. And so I would say yes to the new mayor. Come and shake your hand. But I don't want to see you then for another year and just want to
Look, I think the role of government is to set the direction. I agree with Steve on this. You and I were in a panel where you said, what would you have done differently about the Affordable Care Act? I don't know if you remember, for the World Affairs Council.
Boy, do I remember.
And I said, I would have done exactly what President Obama did until we tried to implement it, and then I would have said, I'm only kidding. Because I think what it started was a dialogue between Dan Hilferty and us that really has changed things. It's the same thing. A new mayor should come here and say, how do I want to define Philadelphia health 5 years from now on behalf of our citizens? We want easier access. We want better quality. And then they ought to let people like Steve and I and Ralph Mueller and John Fry and others get together and accomplish it.
But it does sound as if removing some barriers, whether they're barriers around zoning and building or barriers around collaborating with schools and other businesses, might be something that the new mayor could do.
Make it easy. That's what entrepreneurs do. They make it easy for people to do things. They should make it easy for Steve and I to talk together and provide better care for our citizens.
Yeah, I mean, our plan is to invest over $2 billion in the city over the next 5 years. New campus in Center City, a whole host of facilities around the area. That's going to transform the city. So help us.
Remove those barriers.
Yeah.
All right. Well, thank you very much. Thanks, Steve. And fortunately, it sounds like the Meds part of Meds and Eds in Philadelphia has a bright future. And you certainly have seen two of the brightest leaders in the country. Fortunately, we have them here in Philadelphia driving it forward. So thank you very much, and then you'll have another program here in a second.
Thank you. Thank you.